Hello, this is Dr. Saifi. I'm a board-certified plastic surgeon. I practice in Newport Beach, California. Today, we're going to be talking about blepharoplasty, upper and lower eyelid rejuvenation. Very interesting topic. I do a lot of these primary and revision cases, complex ways. When you look at the upper lid and the brow, you have to look at them as one unit. So first you have to assess the position of the brow, the amount of skin and fat into the upper lid, the position of the upper lid itself, do they have ptosis or not, and then also whether they would need to have the brow lifted at the same time. Once you make that decision, then you go into, again, brow lifting, small incision in the hairline, use the endoscope or no endoscope, well release the area, and then place it where it needs to be by different methods of fixation. Talking of the upper lid, so the upper lid, we all have creases. The beautiful incision of the upper lid, it falls into a crease, which is, guess what? It's an incision. So incision becomes the crease, so technically there is no real scar. And then through this, we prefer now the muscle sparing technique, which is you don't remove the muscle, you just release the muscle, go in. If you need to remove the fat, you can remove the fat. If you need to put sutures for the lacrimal gland, if the patient has lacrimal gland ptosis, you could do that at the same time, and then proceed with closure of the upper eyelid. Now, sometimes the patient has ptosis, which is weakness of the muscle, and then sometimes you need to do application of the tendon or other techniques, depends on the amount of weakness. And that's an important part in upper blepharoplasty surgery. Once you finish with this, then you go to the lower lid. The lower lid is more complex. You have to decide whether there is sagginess of the lower lid, excess skin, excess muscle, excess fat, whether the position of the lower lid is proper or not. Some patients have an ectropion, which is exposure of the eye, which is actually a medical condition. Some people have rounding of the lower lid, and you got to be very careful which one has what, because you can do a beautiful surgery, but you don't fix the lower lid properly, and then you end up with a problem. Incision used, if you do a complex one, then you go through the incision, you try to preserve the muscle as much as possible, you access the lid structures, reshape the fat, which means you can trim some of it, but also redrape some of it on the cheek area in order to have a beautiful eyelid cheek junction, and then trim the skin, trim the muscle if needed. Sometimes you can go transconjunctival, which is for inside of the eyelid, and then just trim the skin on the outside. Fixing the eyelid is key. You got to assess the weakness of the eyelid. If you need what we call a canthopexy, you could do it, which is basically tightening of the tendon of the lower lid to its original position in order to avoid any ectropion after surgery. Some patient might need a little bit more than that. There's something called canthoplasty. We usually don't do that in cosmetic surgery, which is more tightening and removal of excess skin. So another question that comes from blepharoplasty surgery is expectation, which is extremely important. And to me, expectation, it depends on the anatomy. What is there already? So if someone has very good skin and just have some excess in their upper eyelid, and then they have a proper brow position, I think a straightforward blepharoplasty will do a very good job. If someone has a little bit of excess fat, then we have to take the fat. Interestingly enough, if the weight stays stable, most blepharoplasty surgery can last more than 10 years. If there's weight fluctuation, then everything changes because fat can change and obviously stretching of the skin and so forth. Lower bleph is a little bit different. I think there's more gravity affecting the cheek area, exposing the bone and making the lower lid cheek junction a little bit deeper. So one thing about the longevity of the blepharoplasty surgery is related to the anatomy, of how much anatomy disturbance there is. Is there excess skin? The quality of the skin. I think skin quality is key. And this is a lesson I learned over the years. If someone has a lot of sun damage, before you do anything, you gotta try to address that sun damage. You put them on skincare products, you do lasers, something to help with that. And then once you do this and you do the proper surgery, I think blepharoplasty surgery can last more than 10 years as long as the weight is stable. Common question comes to me about eyes. People come in complaining of what? Well, they're complaining of tiredness. They look tired, they look sleepy, they look like they have eye bags, they have dark circle around their eyes. And for each one, I always analyze them. So we take their pictures, we have a computer system that kind of shows them everything, and I mark on the screen and I show them what needs to be done. But I also listen to them. I see what is their concern, what exactly they can do. In my mind, people are divided into two groups, a surgical group and a non-surgical group. And it depends on how busy they are, and then financial situations, time, all this. And we assign the procedure depend on this. So if someone has very mild laxity, just skin, laser can work for these patients. Slight brow position can be adjusted just using Botox, mild skin excess in the upper and lower lid can be handled with laser tightening. Some tear troughs in patients with good skin can be approached with some fillers. Some fat grafting can be done. So that I call the non-surgical group, where you can do small things. Now, if someone has more than that, then they basically need a lot more than just putting some Botox or doing some laser tightening. I think they need the actual surgery. Dark circles is a tough one because dark circles is a combination of things. It is sometimes an actual coloration that's present, which is you have to address it by different skin preparations and lasers. And sometimes it's a shadow. If you have a certain type of shadow in that eye, then you can have more darkness into that area, which means a lower blepharoplasty can definitely help. A lot of times dark circles is a combination of all of the above. So every complaint has a procedure, and whether the patient is a surgical or non-surgical is very, very important to outline in a consultation. Common question is recovery after blepharoplasty. So blepharoplasty, again, this is the center of your face. This is the way you see. And the question we get, can I work on my computer after surgery? And the answer is not the first day. The first day you're probably going to be swollen. It's better not to exhaust yourself too much, strain your eyes. You don't want to do that. Swelling gets better with time. Sutures usually gets removed between day 5 and 7. We do use LED light. We use some medication like arnica and bromelain to help with the process of swelling and bruising. At the end of the day, you gotta plan yourself that you might not be able to use your laptop or read extensively for a few days just to avoid any stress from your work and so forth. But a lot of times you can after 2 or 3 days. So again, every case is different. Every patient swells and bruises a little bit different than others. You just have to tailor it to that specific patient. So thank you so much. I hope this was a very helpful information. Again, if you have any questions that we did not address, feel free to go to our website, drsaifi.com. You can text us, email us, you can call the office, and we're very happy to answer any of your concern. We do like to do a consultation. We even do virtual in terms of getting more information because everyone is different. It's hard for me to really give a full consult without seeing a patient or at least seeing a picture of that. So again, thank you so much, and I hope this was helpful. Thank you.